COVID-19 has wreaked havoc on the entire world, with over 80 million cases and 2 million deaths by the end of 2020. The US should have taken its responsibility as a global leader to spur timely recovery efforts, yet the exact opposite has come true. With over 20 million cases and 350,000 deaths thus far, the US has taken a massive proportion of global empirics, cracking the pedestal the nation once stood on.
We haven't seen anything like this in 102 years since the 1918 pandemic, and it's challenging to the entire world. And we, as you know, the United States has gotten hit worse than virtually any other country.
Tens of millions of people have been thrown out of work. They've also lost their health insurance. And if COVID-19 has taught us nothing else, certainly it's taught us that everybody's health is linked to everybody else's health.
These issues have been there all along, and I think it has peeled the layers back and exposed some of the risks that we have. Now it's up to us to learn from those lessons and make us stronger for the next kind of crisis, which unfortunately will come along.
We live in the richest nation in the history of nations. This is the greatest country on earth. And I refuse to believe that we cannot find a solution that allows every American to afford the medications that they need.
The takeaway is clear. America's healthcare system is broken. Even before the pandemic, 137 million Americans had trouble accessing healthcare, and without expansion, millions more will fall through the gaps in our system every single year. 2/3 of all bankruptcies are associated with exorbitant medical costs, so increasing access would invariably help financially distressed families. Yet calls for healthcare expansion have not been merely limited to just reducing healthcare costs. Disparities, whether they be on the basis of wealth or race, pervade our existing health services, and advocates have made arguments involving democracy, morality, and equality.
In some sense, it's a duty in a democratic society, but it's certainly a right. In the wealthiest society that there's ever been, at our wealthiest moment, everybody should be able to have access to first-rate healthcare.
One of the biggest problems that we have is income and wealth inequality. And let me tell you, a lot of people go bankrupt. They lose their home. They lose all of their money because somebody in their family gets so sick that the healthcare bills become enormous. And given that they didn't have health insurance, they are responsible for those fees. And of course, you're not going to let a family member get very sick or even die.
One of the characteristics of our healthcare system is substantial disparities in terms of race and ethnicity in the availability of care and in the health of populations. One of the most important ways of remedying those disparities would be to extend and improve coverage for the cost of illness.
Despite these pushes for expansion, voters' opinions have been mixed, primarily over the issue of financing. For instance, support for Medicare for All increased to 67% when people were told it would eliminate premiums and reduce out-of-pocket costs. But if they were told that a government-run system could lead to higher taxes, support plunged to 37%. However, experts believe that expansion is worth the price.
We have a very low tax country compared to the rest of the world. You know, there's plenty of European countries that collect 10% more of GDP in taxes than we do, and they're operating just fine. So I think that there's plenty of room to expand the size of the tax base. We have plenty of what we call tax capacity. And we to use that, but we should do it in a progressive way to make sure the rich pay their fair share.
From a budgetary point of view, of course, it would have an impact. But I think over the last 50 years, we have learned one lesson here in the United States, which is that if we don't have people covered so that they go regularly to their doctors, even when they're not sick, for checkups, for testing, not just on coronavirus, but for many other things, then you end up paying more later because those people then develop diseases. You don't catch those diseases early, and therefore the cost is really big.
So the right question is not, will it cost money? The question is it a cost-effective way to spend our money? And the answer is yes. If you look at the value in terms of dollars per health unit improved, or you look at the value for the economy of things like more jobs in the healthcare sector, or people feeling freer to switch jobs because they don't have to be afraid of losing their health insurance coverage.
Regardless, healthcare has been a polarized and gridlocked issue for decades, and attempts to balance healthcare expansion and its financing will inevitably require compromise between all parties.
So we should only care about parties to the extent that they're an instrument of the public interest and the common good. And if they're not, then That's just one more faction clamoring for people's resources.
It's time for us to come together and sort of stop the tit-for-tat fighting that is dominating the political arena and spilling over into all of our lives. Nobody's trying to be bad in what they come up with. They're trying to do their own reasoning and understanding more and more about somebody's motivations and what they believe and what they think can help us understand how they got to what they think a lot better.
The volatile 2020 presidential election may have come to a close, but polarization continues to fracture our discussions of healthcare. In 2021, whether it be through an expansion of existing programs, a public option, or a single-payer system, we urge Congress and a new president to address the healthcare disparities plaguing our country today. We must abandon partisan politics and come together as a democratic government, because if we do not act soon, it will be too late to prevent the nation from flatlining.